Module Overview. This foundational module explores the basic science, history, classifications, and global burden of infectious diseases, while establishing the critical role of infection prevention and control (IPC) as a pillar of modern public health and healthcare operations. We examine how microorganisms spread, how they survive in hosts and environments, and how inadequate IPC practices have led to some of the worst epidemics and pandemics in human history. This module is anchored in post-COVID-19 developments, emphasizing how the pandemic redefined IPC strategies globally. 1. Foundations of infectious diseases. What is an infectious disease? An infectious disease is caused by pathogenic microorganisms such as bacteria, viruses, fungi, or parasites, which may be spread directly or indirectly from one person to another. Key characteristics include transmissibility, reproducibility in a host, potential to cause morbidity, mortality, susceptibility to interventions, epidemiological concepts, incidence and prevalence, endemic, epidemic, pandemic R0, basic reproductive number, modes of transmission, direct contact, droplet, airborne, fomite, vector-borne, types of pathogens, bacteria, e.g., Staphylococcus aureus viruses, e.g., SARS-CoV-2 fungi, e.g., Candida albicans parasites, e.g., Plasmodium falciparum. 2. The evolution and purpose of infection. Prevention and control, IPC. Historical background, early quarantine laws in Venice, 14th century plague, Semmelweis's hand hygiene discovery in 1847, Florence Nightingale's sanitation revolution in the Crimean War, the global IPC transformation following HIV, AIDS, and SARS post-COVID era, emphasis on respiratory etiquette, telehealth, air filtration, and PPE normalization. The purpose of IPC: protect patients and healthcare workers, interrupt chains of transmission, prevent healthcare-associated infections, HAIs, ensure continuity of essential health services, build public trust and accountability. 3. Core components of IPC programs, WHO framework. IPC program and infrastructure evidence-based guidelines, education and training of healthcare workers, surveillance of HAIs, multimodal strategies, monitoring, feedback and evaluation, workload, staffing, and facility design, built-in emergency response planning. These components reflect a systems-based approach, enabling facilities to detect, respond to, and recover from infectious threats effectively. 4. Global and post-COVID-19 IPC transformations. Integration of AI, big data, and telemedicine in infection control. Expanded use of UV light disinfection and negative pressure rooms. Revisions to PPE, doffing protocols. Increased emphasis on mental health support for frontline staff. Policy-driven mandates on vaccination, contact tracing, and crisis readiness. Sociocultural adaptation, from resistance to masks/PPE to normalized preventive behaviors. 5. IPC as a legal and ethical imperative. Duty of care to patients and coworkers, ethical obligations in outbreak scenarios, transparency, informed consent, isolation enforcement. Legal liabilities under Occupational Health and Safety Acts, GDPR, public health orders, and professional codes of conduct. Healthcare providers must act with professionalism, cultural sensitivity, and legal awareness, particularly when faced with ethical dilemmas like limited PPE, resource prioritization, or patient refusal of care. Learning outcomes of Module 1. By the end of this module, you will be able to define infectious diseases and explain their transmission dynamics, categorize pathogens and describe examples relevant to healthcare, summarize the history and purpose of IPC across health systems, identify the WHO core components of IPC programs, discuss post-COVID innovations and ethical obligations in IPC accreditation compliance notes. This module has been developed to align with WHO core components of IPC 2016, CDC guidelines for infection control, UK NHS and UKHSA post-pandemic IPC policies, Public Health Agency of Canada, IPC standards ISO 45001, occupational health, and ISO 15190, safety in labs. It is suitable for CPD certification and healthcare workforce training across clinical, administrative, and public health environments.